Dengue fever is a serious health concern worldwide. It affects millions of people, especially in tropical and subtropical regions. The illness is caused by a virus transmitted through mosquito bites. The mosquito is the primary carrier of this virus. This mosquito thrives in warm climates and breeds in stagnant water. Dengue fever is a growing problem, with cases increasing in recent decades. Factors like urbanization, climate change, and international travel contribute to its spread. Protecting yourself and your community requires understanding dengue fever and how to prevent it. Dengue fever is often a risk for travelers visiting affected areas. Taking precautions before and during your trip is essential. Use insect repellent, wear protective clothing, and be mindful of your surroundings. Dengue fever is caused by the dengue virus, a type of RNA virus. There are 4 distinct serotypes of the virus: Dengue1, Dengue2, Dengue3, and Dengue4. Infection with one serotype provides immunity to that particular serotype, but not to the others. Transmission occurs when an infected mosquito bites a person. This mosquito is easily identifiable by its black and white striped legs. It typically bites during the daytime, making it different from other mosquito species. After biting an infected person, the virus multiplies inside the mosquito. When the infected mosquito bites another person, it injects the virus into their bloodstream. The virus then travels to different parts of the body, causing various symptoms. Dengue fever can sometimes progress to a more severe form known as dengue hemorrhagic fever, or DHF. DHF is characterized by bleeding, low platelet count, and plasma leakage. Prompt medical attention is crucial if you suspect you or someone you know has dengue fever. Diagnosing dengue fever involves a combination of clinical evaluation and laboratory testing. Doctors consider the patient's symptoms, medical history, and travel history to make an initial assessment. However, laboratory confirmation is essential for a definitive diagnosis. The most common test for dengue fever is a blood test called a polymerase chain reaction, or PCR test. This test detects the presence of the dengue virus in the blood. Another test, called an enzyme-linked immunosorbent assay, or ELISA, detects antibodies produced by the body in response to the virus. Diagnosing dengue fever can be challenging, particularly in areas where other mosquito-borne diseases are prevalent. Symptoms of dengue fever can overlap with other illnesses like chikungunya and Zika virus, making accurate diagnosis crucial for appropriate treatment. There is no specific antiviral treatment for dengue fever. Management primarily focuses on relieving symptoms and providing supportive care. Rest, adequate fluid intake, and over-the-counter pain relievers can help alleviate fever and body aches. For more severe cases, hospitalization may be necessary. Intravenous fluids and electrolytes help maintain hydration and electrolyte balance. Close monitoring of vital signs and blood parameters is essential to detect and manage complications. Early recognition and prompt medical attention are vital for improving outcomes in dengue fever cases. If you experience any symptoms of dengue fever, especially after traveling to an endemic area, seek medical attention immediately. Prevention and future prospects, vaccines and vigilance. Preventing dengue fever requires a multi-pronged approach, focusing on mosquito control and personal protection measures. Eliminating mosquito breeding sites by removing stagnant water is crucial. Use insect repellents containing DEET, picaridin, or oil of lemon eucalyptus on exposed skin. Wear long-sleeved clothing and pants, especially during the daytime when mosquitoes are most active. Researchers are actively working on developing effective vaccines for dengue fever. Several vaccine candidates are in clinical trials showing promising results. A vaccine, when available, will be a valuable tool in the fight against dengue fever. By understanding the risks, taking preventive measures, and seeking prompt medical attention when needed, we can protect ourselves and our communities from the threat of dengue fever.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.